This is a tale about a young man named Owen. In the past few weeks, he has been experiencing weird behaviors such as depression, sleepwalking, small memory lapses, and violent actions towards his roommate. Some nights he will stand above his bed and watch him sleep. His roommate, after waking up to find him staring at his bed or laying on the floor in his room, he referred him to a well-known psychologist in the area by the name of Dr. Lyons.
Come in. Hello, my name is Dr. Lyons.
Hi, I'm Owen.
I'm going to be helping you out today.
Alright.
From the symptoms you described, it appears that you have dissociative identity disorder. This disorder is characterized when you switch between two distinct personalities.
Okay. Does that describe the depression, random memory loss, and violent outbursts?
Yes. Amnesia is common when you switch between the two personalities. Also, this other personality of yours may be a violent one. Depression is also a common symptom of DID.
Will this other me hurt my roommate?
Maybe. Try recording yourself at home to try and catch the other personality in the act. This will give you a better idea of what he's capable of.
Okay, sounds good.
Perfect. What are you doing?
Setting up camera. 7 o'clock, Law and Order time.
Oh, hey, Owen. What are you doing?
Just watching TV.
Law and Order. Nice. Okay, so we don't have anything to eat. What do you want to do for dinner?
Huh?
What do you want to do for dinner? We don't have anything to eat. You want, like, Korean? What do you want?
It's up to you.
I don't know. I mean, there's, like, some stuff close by. Yeah, it's all good.
Okay, I watched the video you sent me and it clearly showcases that you definitely have dissociative personality disorder.
I'm not really sure what happened. I was just watching Law and Order SVU and I woke up and I was choking out my roommate.
The Law and Order must have acted as a trigger between you and your other personality. The violence and sex abuse in the show probably was the trigger. Were you ever abused as a child?
Yeah, my father often physically abused me when I was younger.
I understand. This may be the cause of your violent outbursts and the personality that lives inside you. Would it be okay if I try to use hypnosis to communicate with this other you?
I guess so.
Alright, Owen, are you ready to begin your hypnosis treatment?
Yeah, I'm ready.
Okay. Focus on the sound of the ticking and it will lead you into a trance. Just let your mind go blank and just focus on the ticking. Just relax. It will take effect. You just need to clear your mind. Let your mind be a blank slate. Just take deep breaths and let it come into you. Are you the violent personality that's living inside of Owen?
Owen, who's Owen?
If you're not Owen, then who are you?
Patrick Bateman.
Why are you so violent towards others?
They want to hurt me, I hurt them first.
Do you think I will hurt you?
Yeah.
Okay, I've heard enough. When I clap, you're gonna wake up from the trance.
What happened?
Okay, your personality came out during the hypnosis as planned. He calls himself Patrick Bateman. Does that name mean anything to you?
No. What does he want?
You tried to attack me there when you slipped into your other personality.
Really?
Yeah, but that wasn't you, it was the other personality. You probably had amnesia from when you switched and you probably remember nothing from it.
Okay.
He wants to hurt others because he believes that they want to hurt him first. I believe that this is because of the repressed memories that you had from a child, and so your mind created another personality to deal with these thoughts because you just couldn't handle them. I can prescribe some medication for the anxiety and the depression you feel, but there is no medication for this other you. It's probably going to stay with you for your whole life. We can, however, do treatments to suppress it and keep it under control. Let's start with some Prozac for the depression.
Alright.
And Owen continued his therapy for another 2 months, and he came back a few months later for a checkup visit to see how his medication and therapy was working.
Come in.
Hi, nice to see you again, Dr. Lyons.
I see you too again. So how have you been?
I've been good. I think the hypnosis is working. I mean, my life is slowly starting to become normal. The medication is helping with my symptoms. And I don't know. I mean, I've been able to control Patrick a lot more.
That's good. I mean, with dissociative identity disorder, you'll never be able to fully control your personalities or completely get rid of them, but we can definitely keep them under control, and you can suppress the violent effects of Patrick if you keep up with your medication.
Okay.
And Owen started taking his medication for another 3 months, and then it was time for another checkup with Dr. Lyons. Owen continued to go to regular sessions with Dr. Lyons and stayed on his medication for another 2 years. Then Dr. Lyons decided that it was okay for Owen to be off his medication. After 2 weeks, Owen committed several petty crimes and is now back on his medication, living safely on a sheep farm with his grandma.
I'm like a dog chasing cars.